So this is a drawing of the shoulder, and I'm going to show you the different components. This is a right shoulder. And first you have the collarbone or clavicle coming in, and above that is the acromion. That's where the bony spur develops that starts digging into the rotator cuff and irritating it. Now the second muscle under the skin at the base of your neck is called the supraspinatus. And these are the fibers of the supraspinatus muscle that go to the top of your humerus or your upper arm bone. And when you make that muscle work, it allows you to raise your arm above your head. As people get older, they start developing on this bone a little bony spur that starts digging into that tendon, and this is where the rotator cuff comes into the bone. And so when we see a patient in the clinic, we take a look at the patient, we examine them for certain physical findings suggestive in addition to the history of rotator cuff disease. And at that point in time, usually the first step is just to put the patient on an exercise program that tightens up the muscles and gradually starts improving the pain. And we also inject some pain medicine between the acromion, or the bone with the bony spur, and the rotator cuff tendons to try to get the inflammation under control. We use a little bit of steroid. Now when you look at that bone, the acromion, from the side, you'll see that this, what looks flat across the bottom, really develops this bony spur that is digging into the rotator cuff on the top of the bone, and that's what causes all that pain. There is a certain percentage of patients that you can't get better with some exercises, a little medication, and an injection. And so what we do with those patients is that as an outpatient in River Park Ambulatory Surgery Center, where you can save a lot of money relative to the hospital, we just make 2 or 3 little small incisions, and it takes about 15 minutes to burr that bony spur away. It's very simple, very straightforward, very high rates of good or excellent results. Now there's a small percentage of patients where the rotator cuff actually gets torn all the way and retracts away from the top of the bone, and those patients get to the point where they cannot raise their arm, or they start losing the strength of their arm. So at the same time with those patients, another 15 or 20 minutes is utilized in the operating room at the same time, and a little small incision is made right here where the rotator cuff is reattached to the bone. Now on the average patient with just the bony spur and impingement syndrome, 2 to 4 weeks of therapy, and 90% of those patients are much better very soon after their surgery. When the rotator cuff has to be repaired, it really takes several months of that tendon being held into position by the sutures that we use to reattach it for it to grow back into the bone and become solid. So we have very specific rehabilitation programs for rotator cuff tendonitis, which is just the bony spurs, or rotator cuff tears. And we've got a physical therapist, Michael Wimberly, who's just done so many of these with me over the past 10 to 15 years. He is truly masterful in how he really rehabilitates shoulders. In a moment, I'm gonna get Kedra, one of the people that works with me, and show you on the physical exam how a rotator cuff presents, and we'll finish up. And I hope this video is educational for you, because shoulder pain, we should be able to help most all patients that have a significant shoulder pain.